So I'm a fourth-year medical student at the University of Michigan Medical School, and then I attended Case Western University for the SMDEP program in 2006, I believe. So much. I think for me, one of the most important things was to be with a cohort of really highly motivated people, students who, very much like myself, were interested in medicine that went beyond the walls of the clinic and the ORs, interested in looking at health disparities, health inequities, and how they could really change healthcare systems. It was really exciting to learn along with them in that process. So that was one of the things that helped me emotionally, I think, prepare to go into the field of medicine, which I think today is not just about working in a hospital, but working in a community and working within a nation. There are other things that it did for me as well. I mean, we took classes and I was able to look and be in the operating rooms and shadow physicians, and that was also really beneficial. I did things that I loved. I made a distinct effort to really enjoy things, my hobbies, and serving other people. And I actually spent the year prior to medical school in French Guiana doing a lot of children's classes and youth programs, and found that to be a very enriching experience that really had nothing to do with the actual day-to-day of clinical care, but had everything to do with who I was as a person and how I identified. And for me, preparing for medical school was much more of an emotional kind of commitment than sitting and studying books. I would say that for me, I see myself as a clinician, but also a patient advocate. I think as a physician, I will choose to be in a role where I have, one foot in my clinic or in my operating room and the other foot in the community and really in policy circles. And so using really the stories of my patients to help drive policy and really to drive systems change is something that I see as a really critical role for myself and for a lot of my colleagues. I had some really outstanding mentors when I was a pre-medical student. One of them in particular would always ask me when I walked into her office, what is your mission? What is your goal? What do you want to achieve? And that went beyond, I want to be a medical student or I want to get into medical school, because understanding that it's really a path. There really is no endpoint. There is not one day when all of a sudden you are a doctor. It's a process of becoming. And I think through a lot of the conversations I've had and the relationships that I've formed along this path, I've learned that what really motivated me to kind of choose medicine and to go into this field was understanding that it is a journey and that I'm primarily here to serve. And I can do that as a teacher, I can do that as a healthcare administrator, I can do that as a lawyer, I can do that as a mother, but I chose this role as a physician because I think that being able to actually heal people physically as well as emotionally, and then looking at healing the healthcare system is something that's so unique to being a physician that I wouldn't want to do anything else. Atul Gawande once told me that it's not necessarily balance, Charlotte, it's trade-offs. And I think that is actually pretty true. You learn to just prioritize. So I do have time for things that I love doing. I spend time with my family, my friends. I make sure that I connect with people on a daily basis. There are some points in one's career and one's, especially in medical school, where you feel distinctly unbalanced, and you have to be okay with that. There are times where you get very little sleep or your eating habits are completely... I remember I came home one day after a day in clinic where I had talked to a lot of patients about their weight and obesity, and what did I have for dinner? I had a Snickers bar. And so balancing your own lifestyle habits kind of with the confines of your profession is really important. And so for me, it's a day-to-day struggle. But I do enjoy running and singing and spending time with friends. So at the AAMC, it's been so much fun. This is really one of the first times that I've totally enjoyed my summer internship experience, mainly because I'm doing work that I really love and I'm passionate about. So one of the projects I'm working on here is looking at medical education. And so how do we teach about health policy? How do we teach about health systems in medical school, specifically in the 4 years of undergraduate medical education? And it's a challenge because it's one of the things that we don't know how to do very well yet at this point. And so thinking about that and really driving that change, coming at it with the experience of having been a medical student and currently a medical student, I have a vetted interest in that area. And then thinking about how the experiences of my colleagues and really looking at those who've gone ahead of me, to residents and physicians who all say that it's really important for us to understand the system of healthcare as medical students. It's not something that we can just relegate to residency or beyond. You have to start learning about it as a foundation of your medical training. And so having that really centered as kind of one of my passions has been exciting. And it's been really, really exciting to work in diversity policy and programs here. And with Dr. Neve and Malika Fair and yourself, it's been an outstanding experience and I've learned so much.
Great, thank you.